The world has witnessed devastating pandemics, with perhaps one of the most resounding being the 1918 pandemic influenza or Spanish flu, an event which happened 100 years ago and which claimed more lives than the First World War. Events such as pandemics not only lead to tragedies like losses of human lives, but also results in debilitating economic consequences that could erase economic prosperity and peace, which in many countries might have been painstakingly achieved. Today the world has become much more linked and mobile, which means that the virus could spread in a matter of hours across continents, which was not the case, of course, in 1918. This makes it more challenging to control the infection. However, unlike in 1918, scientific advancements have led to availability of vaccines, antiviral treatments, and diagnostics. During a pandemic, WHO will strive to ensure that vulnerable populations everywhere will have access to these medical interventions. In 2011, the World Health Organization and its member states have adopted the Pandemic Influenza Preparedness Framework, which established a benefit-sharing system to provide equitable access to vaccines. This mechanism allowed WHO to secure about 10% of global pandemic influenza vaccine production. During a pandemic, some countries may have the possibility to produce pandemic vaccine domestically, while many may not, and may rapidly need to access vaccines secured through the PIP framework. Regardless of internal vaccine producing capacities, each country should have a plan for national deployment and vaccination, particularly for non-vaccine producing countries which may be in the first access to WHO secured vaccine. It's important to note that the existence of such a national deployment plan will be a prerequisite in the application process to access the committed vaccine quantities to WHO. When countries receive vaccine, effective deployment leading to timely availability at national level is crucial to ensure that all allocated vaccine reach the beneficiaries and there are no wastage along the different steps of deployment from manufacturers to the vaccine administration point. Countries must be prepared for this. WHO will base its decision on allocation of vaccine to countries on their capacity to manage and make best use of these scarce resources during a pandemic. This is why we are inviting you to take this course, which provides succinctly, and we hope in an enjoyable format, current best practices that could be used to develop or review existing national plans for the deployment and vaccination for pandemic influenza vaccines. The course provides information contained in the WHO guidance on development and implementation of a national deployment and vaccination plan for pandemic influenza vaccines. A document which was compiled using inputs from a group of international subject matter experts, also including lessons learned from the 2009 H1N1 influenza pandemic. The course also offers valuable transferable lessons that could be applied to the deployment of vaccine for other outbreaks. We thank you for your interest and we really hope that you will enjoy the course.